Hey guys, this is Danae. I'm back again. So you guys have a little bit of a different background right now. This is my new place, and I wanted to highlight some of the artwork that I bought in Botswana and in South Africa when I was working in public clinics during my undergrad in Africa. So yes. So today I'm coming to you to give you some tips about clinicals. I think clinicals, we're all, after we got out of didactic, we're like, yes, clinicals, yeah, yeah, yeah. It can be so exhausting. It's just like some of those things, like you don't want to do them. Like I had no interest in surgery. Now you have to sit through 85 hours a week for 5 weeks. If you don't like ortho, you have to go on an ortho rotation. Like clinicals. Oh, I like even at the end of clinicals, I was like, oh my God, do I even want to be a PA? Did I like anything? So I will also say that I did have some challenging rotations. And I think that was mostly just because like the clinical team knows your personality really well. So if there is a preceptor that might be notorious for being difficult, and I really hate to use that word, you might get placed there if you have a personality that's really good at charming people. Or just getting along well with people. And I think that's, and the clinical team knows your personality, or they should. So I'm going to give you guys my tips. The first would be like, just know that you're there to learn, learn, ask questions, and be prepared. Being prepared is the most important thing. Showing up early to read through the cases. I always did that, like showing up early, reviewing the patients. When I was in surgery, I would look up the surgery, like write down the surgeries that I was going to go to, look up the anatomy, and then look up the procedure because they're going to ask you about it. I never went into the OR without knowing the patient's name, why they were there, and their past medical history. Even if I was going into 4 surgeries that day, those are things that you just have to know. And then also I would say, just try your best to, always be polite, always be courteous, especially to, you might be with a PA, an NP, or you might be with a doctor, but just be courteous to everyone, which that should just be who you are, but that's not common knowledge or common sense, and everybody wasn't raised that way. But be courteous to everyone. Be courteous to the nurses, be courteous to the medical assistants, be courteous to the techs, because those people are so important, and every job is important, and that can really make or break your experience. Because I had a situation where I was literally on a rotation and the nurses saved me. I don't want to say like I had a bad preceptor, because everything is what you make it, but I had a preceptor that I didn't blend very well with, and that can very well happen. Sometimes we're thrown on residents, or some people have this break you down to build you up type attitude, and if you don't crack and cry like other students did, they are not pleased. But so the nurses saw me and they were like, Danae, no, code red, come this way. And it was just kind of like dodging. I kind of like was able to escape a negative encounter with my preceptor that was like in a very bad mood that day. And so just making those connections are so important, and it's just better for your life. So I will also say following up is super, super important. And I say following up because things like credentialing, that's going to happen, and you're going to need to, have references and have a job. So every time you go into these clinicals, think of it like that, that you might need a reference. And the way that I kept up with people, I needed 8 references to go through credentialing at the hospital that I got hired at. The first person that was my preceptor in primary care was one of my references. She did one of the online references for me. And actually, surprisingly, a surgeon that doesn't even like having students was the other person that did my reference, because I worked so hard and developed a really good relationship with her just because I have strong people skills. And at the end of the rotation, the first day I thought she hated me, but by the end of the rotation, she was like, I'm gonna miss you. And her nurse told me, she was like, I've been with her for 3 years. I've never seen her like one student. So that was really nice that she went out of her way and gave me a positive recommendation. So what I did with all of my preceptors at the end of the rotation, I thanked them. I said, thank you for your time. I really appreciate it. You know, this is what I'm interested in, blah, blah, blah. And then a couple months later, I would, like every semester, I would email, like that first person, I would email her every semester saying, okay, I completed this clinical, I completed this clinical or this rotation, this is where I am, oh, I just took the PANCE, I passed, I got this job. And so it's not like, okay, we had a good like a good clinical experience together almost a year ago, and now I'm calling you and you haven't heard from me, because that doesn't seem sincere and that doesn't seem genuine. So that is my biggest recommendation: staying live and staying active, because I've talked to greater than 50% of my preceptors and updated them once I got a job, or once I passed my PANCE. So those are my tips for clinicals. And my other tips would just be to make sure you sleep, make sure you eat, make sure you take care of your personal hygiene, make sure you use the bathroom. And I know those things seem like they're common knowledge, but it's like, if you're running around from case to case, you need to eat. Like, you can't, if you don't help yourself, you can't help anyone else. So guys, if you have any questions about clinicals, or if you're having any difficulty in clinicals, please feel free to reach out to me. And also, clearly I am a student of color, so if anyone is facing any issues in the clinical realm relating to race and ethnicity, I can totally be there for you and talk you through the process, because those things do happen. So guys, it was nice to talk to you. Let me know if you have any questions. Bye.